Hi, welcome to the clinic. I see that we have you in as a new patient today for a full body exam, is that correct? Wonderful. Please take a seat. Being that you are a new patient, we're going to have to do a new intake form for you. If that's alright, it's just going to be some questions. And once we get through that, we'll do your head to toe exam and then we'll get you on your way. How's that sound? Wonderful. First things first. What are your first and last name? Great. And your date of birth? Wonderful. And your marital status? Single, married, separated, divorced, widowed? Okay. And do you remember when you last had a physical? You don't? Okay. Now, as a child, do you remember ever having measles, mumps, rubella, chickenpox? Okay, chickenpox. Any surgeries in this last year? Okay, good, no. Any other hospitalization? Anytime you were admitted? Wonderful, that's always good. Okay, are you currently taking any medication that is prescribed? No? Any over-the-counter medications? Just aspirin, alright. Wonderful. Do you have any drug allergies that you know of? Or any allergies in general? Okay. Great. Now, let's talk about your lifestyle a little bit. Do you have a sedentary lifestyle? And this can be anything from work to what you do on your free time. So, do you sit most of the day? Are you active? Are you active a little bit and then sit some? Okay, a little bit of a mix, alright. Now, how's your diet? Do you eat relatively healthy? Plenty of fruits and vegetables, not too much alcohol? Not too many fatty foods, fast food? Okay, good. How about your caffeine intake? How much coffee do you drink in a day? 3 cups isn't too bad. And alcohol? Do you drink a lot? Or if at all? No? Okay. Now how about tobacco? Cigarettes, pipe tobacco, chewing tobacco, cigars? Okay, good. Now how about any recreational drug use? It's okay, you can tell me, you're not going to get in trouble. Okay, good. That's what we like to hear. Okay. Good, good, good. Are there any family health issues that I should be aware of? Okay, good. Let's talk about your mental health a little bit. Is stress a major issue for you? Do you go through your days feeling very anxious or always on edge? A little bit? Okay. And do you feel depressed ever? Okay, it's normal to feel sad sometimes, but do you feel depressed often? Feelings like you can't get out of bed? Feelings like the things that you used to like no longer bring you joy? Okay. Do you panic when you are stressed? Sometimes, okay. Do you have any issues with eating or your appetite? Do you notice if your mood ever affects your ability to eat? 3 meals a day? Okay. Do you cry frequently? That's good. Do you have trouble sleeping at all? A little bit. Okay, well, we can look at that, and if that's something you're really concerned with, we can definitely recommend you to a sleep clinic. We know quite a few wonderful ones. Alright, so let me just bring up your examination chart here, and we'll get started. But it looks like we are good there. Alright, you doing okay? Do you have any questions for me? Alright, so let me glove up, and we'll get started on your exam. First, we're going to check your vitals. I know the nurse up front got your temperature already, so we're going to do a quick blood pressure check on you. I'm going to check your pulse, and then we will get into looking at you more in depth. All right, how's that sound? Wonderful. Wonderful, wonderful. Is there anything you are worried about currently? Anything that you want to talk to me about? Any physical issues going on or mental? You can talk with me about either. Alright. Good, good, good. Alright. So first things first. get my blood pressure cuff. Get my stethoscope. And let's get that blood pressure. It's a lot of Velcro, I know. Alright, so let's just get that cuff on your arm over here. Good, good. Good. Just make sure that's settled right. Okay, good. Alright, just hold still for me. It's gonna get a little tight. Okay. All right, we're going to take that one more time. Very good. Wonderful. Blood pressure looks great. No complaints on my side. Alright, so blood pressure is very good. Wonderful. Wonderful, wonderful. Alright, so before we get into looking at that beautiful head of yours, I'm just going to take a quick listen to your lungs. Come up kind of close here. Okay, so what I want you to do is just breathe normally, just in and out. Just like that. Again. And one more time. Good. And over here, same thing. Breathe in. No, good. And in again. And one more time. Good. And I'm just going to reach around to the back. Gonna get a little close. Okay. Breathe in. And out. And in. And out. Good. And reach around the other side here. Okay. Breathe in. And out. And in. And out. One more time for me. Good job. Well, your lungs sound amazing. So that exercise that you are doing, keep it up. All right, respiration, good. Wonderful. All right, now I'm going to take a look at your head here. So I'm just going to come up kind of close. Going to palpate around in your hair, just feeling for any lumps, bumps, you know, anything that shouldn't be there. Just going to gently go through your hair. Let me know if anything hurts at any point in time. You're doing good. Doing great. Alright. Looking pretty good. Pretty good. Okay. Alright, so I'm going to reach up here. I'm going to touch your temples, okay? I'm just going to palpate them, just like this. Let me know if it hurts. Okay, good. And let me feel that jawline a little bit. Just gonna palpate your lymph nodes at 7 different spots. So we got spot 1 right here behind the ear. Down to the jaw, number 2. Okay. Lower in the jaw, number 3. Let you add a little bit for me. Thank you. Alright. Okay, and I'm going to come under the chin here. Okay, good. Down to the neck. Just going to feel that. Okay, very good. While I have you and we're taking a look at that face, go ahead and tilt your nose up for me. Take a little look up those nostrils. Make sure that I'm not seeing any issues with your sinuses. So go ahead and, yeah, just hold that up. Okay, good. And the other side here. Get a little redness in there. You feel any irritation today? Did you blow your nose a little hard? Okay. It's fine. I want to make sure you're not suffering from nosebleeds or something. Wonderful. Nasal vaults is good. Head and hair is good. Good, good, good. We're going to get this part out of the way a little bit early. I do need to do an oral cavity examination. So everybody's favorite tongue depressor. So just give me a big ol' ah. Alright. Just going to take a look inside. Okay. Again, I'm just using the depressor to push your tongue out of the way so I can look. Just looking. Just making sure there's no sores or lesions. Teeth look fairly healthy. That's good to know. Do you go to the dentist regularly? Good. And take a look at that uvula back there. Alright, nice and pink. Hanging nice and well. Good job. Alright. Wonderful. Mouth looks perfect. Make sure you keep going to those 6-month dentist appointments though. Good. Oral cavity is good. Alright. Okay. So, I want to take a look at those eyes of yours, alright? So I'm just going to come up real close. Take a look. Make sure I don't see anything. Dry skin or scaliness around the actual eye itself. Good. Good. This is going to get a little more in depth. Don't you worry about that. If I run my fingers right under your eyes, how's that feel? Good. I'm just going to lift your eyebrows up a little bit. Does that hurt at all? Okay. Look at me. Go like this. Good. One more time. Good. Good. So I have a little bit of a uncomfortable test. It's not going to hurt, but it might feel a little odd. Just going to check the reflex of your eyelid. So I'm going to take this cotton ball here, and we're just going to pull out the tiniest little bit. I do apologize for all the traffic noises outside today. I know that could be a little distracting, so what I'm going to do is I'm going to take this little wisp. I'm bring it right up to the corner of your eye, and I'm just going to brush it and to make sure that your eye responds, okay? Alright, so here we go. 1, 2, 3, brush. Very good. 1, 2, 3, brush. Very good. And we're done with that. See? Painless. Okay, eyelid response. Very good. Good. Alright. Take a look at those pupils. Make sure that your eyes are going to respond to light properly. So what I'm going to ask you to do is I'm going to cover one eye here, and I'm just going to swing the light in and swing the light out. Swing the light in and swing the light out. In and out. In and out. In and out. In and out. Wonderful. And on this side, same thing. In and out. 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 Wonderful. Pupillary response looks very good. Wonderful, wonderful. Going to take little bit of a closer look inside those eyes. I have my ophthalmoscope scope here, and all I'm going to do is I'm going to be coming up real close. Real close, okay? And I'm going to be taking a look inside your eye. I'm going to be holding your eye open during this, okay? Alright, so just hold still for me. I'm just going to hold your eye open. Just look straight. Just look straight. Just look straight. Okay? Now look up, please. Look up. Look down. To your left. To your right. Good. We're going to do the other side now. Same thing. Just look straight. Look straight. Good. Look up. Look up. Good. Look down. Look left. And look right. Good. Good. Nothing out of the ordinary there, which is great. We're going to do a little eye acuity. So first things first, I want you to follow my light. Both eyes open, looking straight ahead at me. You can look at my nose. And here we go. Just follow that light. Good job. You're doing great. Just keep following. Wonderful. Wonderful. Now keep following the light. You're doing wonderful. Now keep following the light. And don't get distracted by my finger. Don't get distracted. Don't get distracted. You're doing great. Gonna bring that a little closer. Don't get distracted. And over here, same thing. Don't get distracted. Don't get distracted. Keep following. Keep following. Good. You're doing fantastic. Everything is looking 100% so far. Alright, now I'm going to cover one eye. And I want you to do the same thing. Follow that light. Just follow it. Just follow. Follow, follow, follow the light. Good. And the other side. Just follow. Just follow. 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 Good. 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 Wonderful. Okay. Where did I put that? Here we go. So we're going to do a little bit of an eye test on you, just to make sure that everything's doing well. First, we're going to do a smaller eye test, and then we're going to do the larger eye chart. Alright? So we're going to do the up-close one first. I want you to just two eyes, follow along with my finger. Read after me. Good. Good. Great. Yes. Wonderful. Good. Fantastic. Good. Good. And how about down here? How about down here? Great. Now, if you'll just stand up and take a few steps back, we're going to do the larger eye chart. Alright? Okay. Now we're going to do an eye exam. With both eyes open, please follow my pointer and repeat the letter that I point to. Good. 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 Excellent. Very good. Good job. Wonderful. Good. Very good. How about this one right here? And all the way down here. Good. 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 Now, I would like you to cover your right eye and repeat the letters back to me. We're going to be doing random letters here. So, here we go. Good. 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 Very good. Yes. Wonderful. Very good. 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 Now the left eye, and we'll do that again. 1, 2, 3. Good. 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 Yes. Good. 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 This one. This one. This one. This one. This one. This one. Very good. This one. This one. This one. Good. All right. I'm not seeing any problems. We'll get back to the rest of the exam. Well, my friend, your eyes, I can definitely say, are working perfectly. Let me just make a note in your file here. Good. Wonderful. Now we're going to take a look at your ears, okay? So I'm going to take a look over here, and I'm just going to palpate, 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 palpate. Just let me know if at any point anything hurts, okay? And on this side, same thing, just going to palpate. Just palpate, palpate, palpate. There we go. Good. You're doing great. Alright, now if I touch both at the same time. Any pain? Any pain? Alright, wonderful. Grab my otoscope. Take a look inside those ears. Alright. So I just want to gently slip the otoscope inside your ear canal. Good, not seeing any redness. Good. Your tympanic membrane looks wonderful. Very good. Let's take a look at the other side. And over here, just gently entering the ear canal. Ear canal looks good, nice and clean. No redness or irritation. Tympanic membrane looks good. Great. Do a little bit of a hearing test on you now. I want you to close your eyes for me. Just go ahead and close them. I'm going to make a noise on each side. And you just raise a finger and indicate which side you heard it on, okay? Alright, here we go. Close them, close them, close them. Alright, and good. 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 Wonderful. Alright, go ahead, open your eyes. You can blink a few times. And then we're going to do the same thing, except this time I'm going to whisper a word in your ear, and I would like you to repeat it back to me. Alright? Close them, close them. Close your eyes. Here we go. Pineapple. Good. Pizza. Good. Coconut. Coconut. Chocolate. Very good. Vacation. Good. Relax. Good. Sleep. Very good. Alright, so ears are looking good so far. Wonderful. Wonderful. Do a little bit of a hearing test on you again with tuning forks. I'm going to be using this one and one more. So I would like you to close your eyes again, and what I'm going to do is ring the tuning fork. Hold it up to your ear, and you let me know when you can no longer hear it. Alright? This one's a little bit higher pitched than my other one, and we're going to use both. Great. Close your eyes again, and here we go. Good. Good. We try not to make them too loud. Good. I'm just making sure that you can identify the high pitch. Good. We're going to move on to one that's a little bit louder. Same thing though. Close your eyes for me. And let me know when you can no longer hear it. Good. 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 Go ahead and open your eyes for me. Ears are looking absolutely wonderful. Fantastic. Okay. Good. Alright. Now we're going to take a look at your chest a little bit. Just sit up straight for me. Keep those shoulders back. I'm just going to be taking a visual inspection, palpating gently up here around your collarbone. So just let me know if anything hurts. Any pain? Okay, good. Now I'm going to percuss on your chest. Good. 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 Okay. Good. Take a listen to your heart. Make sure that it's beating nice and strong. Breathe normally for me. Just going to get up a little close. And just breathe. Good. Just relax. Just breathe. Relax and breathe. Wonderful. Your heart sounds great. Alrighty. Chest looks good. Lungs sound good. Heart sounds good. Wonderful. Good, good, good. Alright. How you feeling so far? Good. Alright, we're going to do a look at your extremities. So I'm going to take a look at your hands, look at your knees, text your reflexes, okay? Alright, so why don't you hand me your hand here. I'm just going to gently palpate each finger individually. Let me know if you feel any pain. Any pain. Good. If I wiggle your wrist. Good. Other side. Palpating each finger individually. Any pain? Alright. Good. And if I wiggle your wrist, any pain? Alright. I'm going to give you my finger in this hand over here, and then this hand over here, and I want you to squeeze as hard as you can. Alright? 1, 2, 3, squeeze. Good. 1, 2, 3, squeeze. Good. Good. So your hand muscles seem to be good. I want to test your shoulders, so I'm just going to place my hands up here on your shoulders, and I'm going to press down, and I want you to try to raise them. All right, so 1, 2, 3. Don't let me push them down. Good, good. Resist, resist, resist. Okay, one more time. This time, I want you to shrug them up all the way, and I'm going to push them down, but don't let me push them. Don't let me push them down. Good. Don't let me push them down. Good. Don't let me push them down. Good. Same thing, we're going to do your face. So what I'm going to do is put my hand on your face, and I'm going to try to push your head to one side, and I want you to resist. All right? Here we go. Resist, resist, resist. Very good. And the other side here. Resist, resist, resist. Good. Good, good, good. The motor strength of arms. Good. Alrighty. Now go ahead and just raise your leg straight out for me. And the other one. Okay, good. If I reach down here and I palpate on your knee, how does that feel? Any pain? Nothing? If I percuss a little bit, nothing? Okay. How about the other side? Any pain? Okay. Gonna check your reflexes now. So we're going to come here, we're going to come over to your left, and 1, 2, 3. Good, good reflex, 1, 2, 3. Good. To the right, 1, 2, 3. Good. And 1, 2, 3. Good. We're going to do your elbow real quick, so just give me your arm. I know it seems weird, but this is a full body examination, so I want to make sure that everything is working properly. 1, 2, 3. Good. And the other arm over here. 1, 2, 3. Good. I do need to do a jaw jerk reflex test on you. I'm going to put my thumb right under your lip here, and I'm going to tap it with my smaller reflex hammer. So just hold still. 1, 2. Good. Reflexes look amazing. Okay, good. Alrighty. So we're going to get on to a little more relaxing portion of this exam. This is the part that many patients seem to enjoy. So, for this part of the exam, I'm going to be testing your sensations. You can see I have a small cotton swab here. There is a blunt end, there is a pointed end. So we're going to call this sharp, we're going to call this blunt, and I want you to close your eyes for me. Close them, close them. And I'm just going to gently touch, 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 touch you on different parts of your face and your neck. And I want you to let me know if you can feel the blunt or the sharp. Okay? And they are distinctly different, so you can feel right here. This is the blunt side. Touch. Good. And you can see this is the sharp side. Touch. See? Easy to tell. Alright, you ready? Close your eyes for me. And here we go. Touch. Blunt, very good. Touch. Blunt again. Touch. Sharp. Touch. Sharp. Down here in your neck. Touch. Blunt. Touch. Blunt. Touch. Sharp. Good. Touch. Sharp. Very good. And touch. Sharp. Very good. Go ahead and open your eyes. Blink a few times. Very good. Knee and shoulders were good. Neck muscles good. And sensations intact. Good. Just going to check a little bit of your cerebral function. Alright, so I want you to sit up straight, and I want you to hold your arms out to your side, and I just want you to bring your finger to your nose. Finger to the nose. Finger. Nose. Finger. And nose. Can you do that for me? Very good. Wonderful. Good, good, good. Alrighty. Just making a few notes on anything I noticed, which wasn't much. I do think that we should probably get you scheduled for a eye exam though, even though your eyes do seem pretty fine. I think that it's been a while since you had one. You should probably get a checkup. And I also think we should schedule you for a follow-up at a sleep clinic, if that would be okay with you. Yeah, maybe get that sleep schedule back under control. I know it can be tough. Life is stressful. But otherwise, you're perfectly healthy. Okay? You feeling better? Good. You're perfectly intact, perfectly healthy. So, up front, they'll help you schedule those appointments. And we'll schedule your next physical. And if you need anything, give us a call. And we'll see you soon. Have a wonderful day. Bye-bye.